Hello, and welcome to today's webinar, Becoming Trauma-Informed, Moving Organizations from Awareness to Action. I am Alyssa Curtis, and I will be moderator for the webinar presented by the National Healthcare for the Homeless Council as part of our spring virtual training with support from the Health Resources and Services Administration and the Bureau of Primary Healthcare. This session is being recorded. This is a 60-minute presentation with the last 15 minutes reserved for Q&A. There is a chat box below the presentation slides for participant questions and technical issues. Please type your questions or technical issues in the chat box at any time during the presentation. A select number of questions will be answered at the end of the presentation during the Q&A session. Remaining questions will be logged and provided to the presenter for written responses after the webinar. If you're having technical issues, you may also call the Council's office at 615-226-2292 for assistance. This session is accredited for 1 continuing medical education credit hour through Vanderbilt University Medical Center. If you plan on claiming credit, please copy the information located in the CME Information Notes pod to the right of the PowerPoint slides and follow the instructions. The text and code will only be available during this session. Our presenter today is Kathleen Guarino, Senior Technical Assistance Consultant for the American Institutes of Research. Kathleen, thank you for speaking with us today.
You're welcome. Well, thank you, Alyssa, and welcome everyone. I'm happy to be here today. Again, my name is Kathleen Guarino, and I work here at the American Institutes for Research. So just a little bit about us. AIR is a nonprofit, and we both conduct research and evaluation and provide training and technical assistance. And really, our mission is, to both conduct research and evaluation, but also really help people apply best practices, particularly in systems that are serving vulnerable populations. I've been doing work around trauma-informed care for the past 15 years, initially beginning in homeless service settings. And as I'm going to discuss today, really my kind of focus and the passion and emphasis in our work is really on how to create trauma-informed organizations and systems. So really thinking at that level about this today. So just so you have a sense of where we'll spend our time today, I'm going to start just by briefly touching on what we mean when we talk about a trauma-informed approach at this broader level. And then we'll really spend the bulk of our time talking about, how organizations adopt a trauma-informed approach. So what's the process? What does it look like? How does this actually kind of come to pass? And then finally, I'll offer a little bit in the way of what trauma-informed change looks like based on what other folks have talked about that we've worked with in the past that have embarked on this kind of change at an organizational level. And I'm going to use today, I talk about organizational level a lot, but certainly it could be at a program level. If your particular program is housed in a larger organization and that larger organization isn't necessarily ready or making these changes yet, certainly that's something that folks can do at a program level as well. But ideally, if there's a large organization that has many different types of programs and services in it, ideally you're looking at kind of a holistic way to adopt a trauma-informed approach overall. So that'll be the focus today. But I want to start with just a little poll. I just want to get a sense of how you all would describe your organization's level of understanding of trauma and its effects on the people you serve. Is it a high level of understanding? Is it moderate? Is there very little? What's the connection, basically, being made between trauma and the people being served? So it looks like a lot of you are saying kind of moderate level of understanding. That's the bulk of you, about 3/4 so far, with about, a variation. So we've got about 17% right now actually saying very little understanding. So that's good to know. Great. Moderate still the top. Thank you all. So it looks like for a lot of you, you're in that kind of moderate range. And that's great. That's certainly a place to start. And for folks that have less understanding or a very high level, for folks that have a very high level of understanding, it may be, what does this mean in terms of taking it to the next level? And maybe some of you are already doing that. And for those of you that have very little understanding, it may be kind of starting from the beginning in your program around what a trauma-informed approach is and why you might consider adopting it. So we'll think over the course of this next 45 minutes or so. I'll really be kind of asking you to think about where you see your organization fitting into this larger process that I'm going to talk us through. So to begin with, I just want to talk about what I mean and what others in the field might mean when we're talking about a trauma-informed approach. So certainly, I'm not going to spend a lot of our time today talking about prevalence and impact of trauma. I think a lot of you know this already, but certainly more and more we're understanding trauma and its effects as a real public health issue that crosses a lot of different service systems, including a lot of the systems that the folks that you work with are navigating. So examples are really high rates among female offenders, mainly interpersonal trauma and domestic violence. Not surprisingly, really high rates, 96% among adolescents. Psychiatric inpatients. We know that homeless mothers have really high rates of lifetime history of interpersonal trauma. Juvenile justice involved youth, often multiple traumas from an early age. Not surprisingly, the bulk of folks in substance abuse treatment report histories of trauma. Children in foster care have also often experienced multiple traumas. So we see this as a cross-system issue and something that really needs a system, a cross-system and a system-specific based response. So there are a number of different ways historically, right, that different types of social service systems are addressing trauma. And we can think about it in kind of a tiered way. So I would say that historically in the trauma field, the first area of focus has definitely been up at the top of that triangle, kind of at the individual levels, right? So developing what we might refer to as trauma-specific mental health services or interventions that are designed either at an individual or maybe a group or family level, and that are really designed to address post-trauma responses in folks, right? So they're either designed to prevent or mitigate the impact of trauma and lessen the likelihood of more significant mental health issues like PTSD, or they're designed to address folks that have diagnosable mental health issues as a result of their trauma. And that could be in many different forms. I think what has happened, though, over the past 20-plus years or so, but even more in the past decade, is that there's a growing understanding that A, not everybody's a mental health professional and can provide those services, and B, that trauma is really too big a problem to relegate to one system or one type of job. And I think that has resulted increasingly in more of sort of an organizational and systems level focus where we're really talking about providing kind of universal approaches to addressing trauma, things that are conducted program or agency-wide or even system-wide, or as it's getting bigger now in the field, community-wide. But at an organizational level, it really means changes to policies, procedures, and the culture of how an agency or service system operates. And just to say a little bit about language, historically in the work that we've done and in some of the work that others have done, we've referred to this universal approach as trauma-informed care. So I would say kind of with a capital T, so at an organizational level. But sometimes there is some confusion with that language, and sometimes when people say trauma-informed care, they mean trauma-specific mental health services. So to avoid, I might say trauma-informed care at different times in this training, so know that I'm referring to the organizational level. But to kind of further address that, another way that it's talked about is a trauma-informed approach or trauma-informed organizations or systems to kind of, or organizational trauma-informed care to kind of further distinguish what we mean. So just to clarify that. So when we talk about a trauma-informed approach, or kind of defining a trauma-informed organization, we're really looking at an organization where all aspects of the service delivery system, right, from beginning to the end of someone's time in your services, from how the workforce is trained to what types of procedures and policies are adopted, they're all grounded both in an understanding of trauma and its impact and designed to address that, right? So designed to promote healing and resilience. So always keeping in mind what the impact of trauma might be and what would be the best way to help someone address that adversity or mitigate the impact of that adversity on them over time. And certainly this approach can be expanded across service systems and across broader communities, as I just mentioned. So using the U.S. Department of Health and Human Services, so SAMHSA, Substance Abuse and Mental Health Services Administration, has some nice kind of definitions and work around trauma-informed care. And I think using their kind of 4 R's here can be helpful. So adopting a trauma-informed approach really means that people at all levels of an organization, number one, just realize the prevalence and impact of trauma. So that was kind of my first poll question, right? Is that number one is that ideally 100% of the people in your organization recognize that trauma is common and that it's potentially impacting people. The second, so just realizing that. Then being able to recognize the signs of trauma in those that you serve. And that helps us to not kind of misunderstand, mislabel, and even misdiagnose behaviors that may actually be, in some ways, very logical responses to trauma. And then it goes from that kind of awareness level, sort of like what we're talking about today, into action, which is really responding by integrating a knowledge of trauma into your policies, into your procedures, into your practices, into how you relate with and engage with the people you serve. And ultimately, we're always trying to resist re-traumatizing youth, families, or individuals, including adults, by we want to resist creating environments that are going to mimic past trauma or cause additional trauma, right? Any practices that compromise resilience and well-being, I would add for all in the service delivery system, and that includes providers as well. So when we think about trauma-informed care at that broader level, we think about it being grounded in some really fundamental core principles, right? So some core values that drive how you operate in the day-to-day as an individual and how you operate in the day-to-day as an organization. And those include, kind of at a fundamental level, the belief that healing happens, but not in isolation, but rather in relationships, but even more importantly than that, in relationships that do not mimic trauma relationships. And then just fundamentally that recovery is possible. And then you really kind of think about the values that you hold when you're doing the work. How are you integrating care as opposed to providing siloed services? How are you ensuring cultural competence in your work, particularly understanding the intersection between trauma and cultural context? How are you promoting safety, physically and emotionally? How is your work informed by an understanding of trauma and its impact? How across an organization and between providers and service users are you sharing power and governance? And in what ways are you supporting control, choice, and autonomy? Really trauma is something that takes away control, choice, voice, and that's what we want to be returning to people as a real focus in our work. So when we think about those core principles, when we do work with agencies, one of the things that's true about those core principles is they sound good, but they're not necessarily easy to put into practice in the day-to-day. And sometimes when you look at this list of core principles, that may not always be the way the organization fundamentally operates. So when we talk about organizational culture or kind of the way we do things here, really a lot of that is happening, if you use the iceberg analogy, below the surface. So there are things on the top that are kind of the day-to-day events and practices and kind of what we can see. But below the surface are the attitudes, the values, the beliefs, the communication strategies, the relationships that really drive how an organization operates. So it's a challenge, I think, to organizations to really look at these principles and ask the question, are we living as if these are our values? And if not, what needs to change? And really the ultimate goal of trauma-informed approach and systems change is just that. It's changing the system in order to change how you operate and ultimately, ideally, the outcomes for folks. So when we think about what this is a shift from and towards, I think it can be helpful to kind of consider what a traditional perspective looks like and how that might differ from a more trauma-informed perspective, right? So in a kind of a more traditional approach, really sort of sees challenging behaviors as the result of individual deficits, right? It's the what's wrong with you kind of question, that there's something kind of internally wrong with that person. Versus a shift to a more trauma-informed perspective that suggests that maybe some of these behaviors that you're seeing are ways of coping with trauma. So the common question that you often hear with trauma-informed care is that shift from what's wrong with you to what happened to you. And it moves from the internal aspect of the individual to the environmental situation that an individual might be coping with. From a more traditional perspective, you might see difficult behaviors as purposeful and personal, whereas from a trauma-informed perspective, once you understand kind of the neurobiology of trauma and what our brains and bodies are designed to do to respond to stress and threat, we have a better understanding of the fact that some of the behaviors and responses that we might see that are difficult may be automatic responses to stress at the body, at the physiological level. A traditional perspective focuses more on kind of changing the individual as the way to fix the problem. And it's not that individuals may not need to do work for themselves, but understanding from a trauma-informed perspective, there's more of a focus on changing some of the environmental factors that may be feeding and have been the cause of some of these difficulties. From a traditional perspective, you see a lot more of the need to uphold authority and control. From a service provider perspective, the idea that kind of punitive approaches are the most effective strategies, whereas from a trauma-informed perspective, you really are trying to shift to offering as much flexibility and choice as possible. You're trying to shift to a more positive, strengths-based approach. But these, I say these things, but these are not necessarily easy shifts to make. And then finally, I think, speaking to what I was talking to at the beginning with that triangle, I think is a shift in perspective that helps us to recognize that support for people exposed to trauma can't just be provided by counseling professionals alone, right? That there's a place for that and that that's really important. But really, support for people exposed to trauma is the shared responsibility of everyone who's providing support. So just given what we've talked about there, and before we get into what adopting a trauma-informed approach looks like, I'd love to just get a sense from you all of where you think you fall on that kind of traditional to trauma-informed spectrum. Where does your organization fall? Understanding that no one's ever clearly in one necessarily or the other. So it looks like the bulk of you are saying kind of somewhat trauma-informed. A smaller percent are saying very, and then there are some folks saying that you really think you operate very traditionally or somewhat traditionally. So it still looks like the majority of folks who are participating in the poll are still saying somewhat trauma-informed. That's great. With the somewhat traditional kind of being next on the list. All right, thank you. So as we think about kind of what happens next, what I want to spend really the bulk of our time on at this point is what does it look like to adopt a trauma-informed approach? How do organizations do that? And the way I talk about this today is based on our framework and our approach to doing this with organizations, based on kind of years of supporting people and implementing this and learning kind of what works and what doesn't. So one of the things that I think is I like this quote, and I think it's applicable to this endeavor, this journey that you're embarking on and that I'm talking about today, which is that the idea of a vision without a plan is just a dream, a plan without a vision is just drudgery, but a vision with a plan can change the world. And I believe that successful adoption of a trauma-informed approach requires both a vision and a plan. So I hope today to offer you kind of both of those pieces to kind of orient you to what this could look like as you move from kind of awareness into action. So one of the things to just sort of note that I want to say about the field of trauma-informed care, and I think where we are, involves kind of a conversation about what's next in the field. So there are a few different, I think trauma-informed care has been around. People are aware of it. You all are even saying you think you're somewhat trauma-informed as organizations. People often have had some preliminary exposure to trauma training or maybe to trauma-informed care, trauma-informed principles. So really, in a lot of respects, what we're looking at next in the field are a few different things. So one is to help people adopt a more formal process for implementation. And I think we've learned a lot from implementation science about what successful adoption of evidence-based or promising approaches looks like. And I think there's a lot of that can be applied to trauma-informed care at this organizational level. A second, what's next, is that we've talked about trauma-informed care a lot across different service systems in the field, but there hasn't been a lot of ability to really measure level of trauma-informedness, if you will, right? So some folks believe, would call themselves trauma-informed after they've had a trauma training. Others might not call themselves that until they had gone through a full organizational process. So it really kind of varies quite a bit. So the idea of having a way to measure that becomes, I think, a really useful next step for the field, and I'm going to talk about a new measure today as part of our conversation. Also, as part of that is really kind of identifying what are some of the universal components of trauma-informed care that cross systems, because none of us are only working in the system that we're in. We always are having interactions with folks in other systems, and sometimes those interactions can allow for a lot of good education, but sometimes those interactions are frustrating because the way that you're operating is not the way an agency that you're referring somebody to or connecting somebody to operates. So really thinking about what are some of the universal components of trauma-informed care that could cross systems. And then I think a big next step for the field is really being able to connect this universal approach with organization and service user outcomes. And I think that this type of approach can be applied to any type of service setting. So in homeless service systems, it might be emergency shelters, it could be permanent supportive housing, transitional housing, or it could be applied to agencies that are providing outpatient kind of community-based services for folks. So there are any number of organizations and organization types that this could be applicable to. So what I want to do is talk through our pathway for adopting a trauma-informed approach that we walk people through and support them in. Really just to give you a sense of what's the overall bigger picture roadmap here. If I want to think about this in my program or my organization, where would I begin to think about it and how would I begin to organize my thoughts? And so this is an organizing framework and structure that I hope will be useful to folks to that end. So the first step in the process. And I will also say that for some of you, some of your organizations may not need to go through all of these steps in quite this way. You may already have jumped ahead and done some things in one step, but maybe want to go back and do some things in another. So I'm presenting this as linear because there is a logical order, but I understand that in the real world, things aren't always that linear, and that sometimes you jump around. So I just want to kind of put that out there as I talk this through. So when we think about what we're talk about as kind of the first phase in this pathway, or the first stage, which is exploring. In that kind of exploration phase, and this is probably particularly true for some of you for whom this is really not an approach that's been kind of introduced broadly to your organizations, I think there are kind of really three key questions to consider. So the first is just, what is our current capacity in providing trauma-informed care, and how do we assess that? Are we all on the same page, right, in understanding trauma and trauma-informed approach? Like, is everybody in our organization educated about this? Are we all working from the same general place? And how ready are we, I think, is a big question. How ready are we to more fully adopt a trauma-informed approach? So let's walk through those just briefly here. So the first is around kind of what is our current capacity in trauma-informed care. And so for that, I want to talk to you about an instrument that we use with folks called the Trauma-Informed Organizational Capacity Scale, or the TIC scale. And this really is the first psychometrically validated instrument that measures trauma-informed care at an organizational level. And it measures trauma-informed care capacity across health and human service settings. So it was tested with service providers across behavioral health, housing and homelessness, child welfare, domestic violence, and ultimately, through the process of instrument development, came out with 35 items across 5 domains that really represent the strongest indicators of a highly trauma-informed organization. So the scale itself really assesses an organization across 5 main areas. So it's assessing, number 1, how you're doing in terms of building trauma-informed knowledge and skills across your staff, how you're establishing trusting relationships with the people you serve, how you're demonstrating respect for service users, the extent to which you're fostering trauma-informed service delivery, and how you are doing in promoting trauma-informed procedures and policies. So there are kind of specific items within each of those domains. So the tool itself, when we work with folks, is completed online. It takes about 15 or 20 minutes to complete. Ideally, it would be completed by as many staff at all levels in a program or organization or department within an agency as possible. And staff are asked to rate the extent to which they agree that their organization incorporates each of the items. And the categories range from strongly agree to strongly disagree. One of the things that we know is if it's a very large organization and you're only familiar with the particular program or department that you work in, we ask that you complete it for that department or program as a whole. But either way, it's not about evaluating your individual performance, but rather about evaluating how your agency is doing as a whole. So this is just a screenshot of the online tool and an example of a few of the items from Domain 1 around building trauma-informed knowledge and skills. So staff are being asked to rate the extent to which they agree. For example, the organization has a written policy that supports staff knowledge building aimed at understanding trauma. How the extent to which they agree that ongoing training on trauma is required for all staff and administrators. So that includes clinical, non-clinical staff, peer support staff, and volunteers. They're rating the extent to which they believe the organization offers training that describes the impact of trauma on the brain and body. And they're rating the extent to which they agree that knowledge gained about trauma is assessed through pre- and post-evaluation of training sessions. So those are just a few examples of some of the items and kind of what it looks like when people are completing it. So what happens is that organizations receive a total score for each domain and then a total score across domains. And to go with that score an overall capacity rating related to trauma-informed care. And so this offers, and we do a pretty extensive report for folks across their organizations and programs, and we can analyze your scores by different factors like how staff in different roles respond, what the differences are between different programs and departments, et cetera. So this really can be a tool for organizations to see where they are and, as a result, where they might like to go in this ongoing process around building a trauma-informed approach. People can use this across different health and human service agencies where it was piloted. You can use it to determine your baseline capacity, and you can use it to assess change over time. If you're part of a larger system, it could be used across that system, and the scores could be kind of collectively aggregated to look at what kind of a whole system score might be. So that's an example of an assessment tool that you could use to evaluate and answer that first question, right, which is just how are we doing right now? What's our current capacity? The second step after just kind of a fresh, clean assessment of where you're at is to get everybody on the same page, right, about what trauma is, how it affects the people that you serve, and what a trauma-informed approach would look like. And that really starts with leadership in an organization, but certainly also includes all staff. Providing everybody with some initial foundational training both, I think, supports people's buy-in to this approach, but it also allows for everybody to make a collective decision about how interested they are in moving forward in adopting this in a stronger way. So the third question when you're kind of exploring where to go with this trauma-informed approach and how to pursue it or move with it is to really look at your readiness. So what is and when we think about readiness, we think about the extent to which an organization is both willing and able to implement a particular practice. So really kind of encouraging organizations to look at kind of their motivation, their kind of current general capacity, and their trauma-specific capacity. And if there are kind of some areas related to readiness that an organization may need to pay attention to or focus on first before they can more fully adopt this approach. So some examples of readiness questions that you could ask yourself right now, but certainly would be readiness questions that after assessing and getting some training, there are some questions that you would want to ask collectively, both leadership and staff. One is just how is this type of approach different than what's already in place at a universal level to support service users? To what extent does a trauma-informed approach add value to the way that we currently provide services? And these are kind of getting to the, what's our motivation to do more with this? How difficult will it be to adopt this kind of approach agency-wide? And then I think it's important to spend some time on questions related to just the general capacity of the organization. So, how well does your organization currently operate? Communication, transparency, staff morale, existing supports, how well are things currently running? How supportive is the leadership of trying new things? How receptive is the staff to change? And then more specifically for trauma-informed approaches and trauma-informed care, what kind of knowledge, skills, and abilities are going to be needed to become a trauma-informed organization? Who in the organization will lead this process? Who wants to champion this approach? So these are some questions that I think can be really useful to start talking about at the beginning, and then not just at the beginning, but continue to talk about throughout. So I want to just take a minute kind of thinking about this readiness piece and just kind of get a sense off the top of your head as you think about this, kind of how ready do you think your organization is to more fully adopt an organizational approach? So really looking at kind of systems change. So it looks like, and we're saying, very ready would be we've got it, right? The investment of time, resources, and energy is there. Kind of, we're all over this. Somewhat ready is people needing to they need and they see the need, they want to invest, but maybe they haven't really developed a formal plan. And that looks like where a lot of you are. And then there are certainly some organizations that aren't ready, right? Like more work is needed in order to be motivated and be willing, right? To be willing and able to invest in the process. So it looks like about a little under a quarter of you are in that bucket, but a large, almost 70% of you are in the somewhat ready. And then you've got 10% who you should reach out to and learn who they are, right? Who are very ready, and maybe ready meaning you're already doing it. Great. Well, thank you. So the next part of the process is putting really the infrastructure in place and developing a strategic plan around what you're going to do, right? So the first most helpful, I think, thing that we've found in our work with organizations is having them establish some sort of multidisciplinary team. We call it a trauma work group, but I would also say that if you work in an organization that already has a team that works on similar approaches, this doesn't have to be a whole separate team. You could join forces. But I think a working group is really the first step towards institutionalizing a commitment to becoming trauma-informed, right? It's ideally a structure that has dedicated staff and time to develop a strategic plan and to monitor progress towards goals. And it really is the first concrete step towards systems change. And we've worked with some organizations that said, our first real systems change was getting this multidisciplinary group together. That was a big deal for us, right? Just to cross the silos. So smaller organizations may have a trauma work group that includes all staff, but for larger organizations that may be creating a smaller multidisciplinary group that is representative of staff in the organization that can report back to all staff. Either way, you want to create feedback loops so that you're including all staff in the process in some way. Then I think I can't underscore enough the importance of sustained leadership involvement, right? So having leaders be on board, leaders meaning the people who can make the decisions, who can approve the changes, who can siphon the resources, that leaders are involved in the work group, that they're talking regularly to staff about the commitment, that they're walking the walk and talking the talk. And that they're ensuring that there are adequate resources, time, coverage, et cetera, to really make this happen. And then it's really about developing a strategic plan. We support people in doing that using the 5 domains of our capacity measure. So really looking at developing plans related to professional development, right? So that's around the building trauma knowledge and skills in an ongoing way. And that includes focus on staff self-care and issues of secondary traumatic stress, which we'll talk about briefly in a minute. The trusting relationships, respect for service users, trauma-informed service delivery, and procedures and policies. And I'm going to go through those now and give you some examples of strategies that people might be working towards just so you have a better sense flushed out of what those domains are all about. It's always helpful to have both short and long-term goals. It's important to really have a plan, right, with action steps, with resources needed, with benchmarks for success. And I think, the work group is a really great place to start to draft those potential plans, but really you want to have some way of getting feedback from all staff and input before you kind of finalize a strategic plan in this direction. And there are a lot of different ways that we help people do that by kind of not just the original instrument, but kind of working with staff to kind of assess what you're currently doing in each of those areas and where some of the gaps are and where you might like to have your goals be. And we've got some templates and things like that to support folks in that. And then it's really about implementing goals. And I would say that you're really looking to implement strategies at an organizational and individual level. Today, I'm going to give kind of more examples of organizational strategies, but I think they're organizational strategies that then support individual practice. So in the first domain, where you're talking about building trauma-informed knowledge and skills, the kinds of things that a strategic plan might focus on are, for example, ways to ensure that trauma training is ongoing. Having processes for assessing whether people are actually taking that knowledge in and actually applying it, right? And having ways to move beyond the kind of one-and-done trainings and into how to integrate trauma knowledge and practice into supervision, staff meetings, case studies, specific concepts or skills of focus for a particular month. How you're going to do that is going to vary based on your organization, but it's about having formal processes in place for this. Making sure you're educating staff on different types of trauma and the unique experiences of particular subpopulations. So, for example, trauma exposure among LGBTQ youth, particular needs for refugee groups, experiences of communities of color, particularly with historical and racial trauma. So really kind of opening up beyond the Trauma 101 into more of the nuances. Identifying what some of the core skills and competencies are necessary to address trauma and support resilience. Ensuring a commitment to trauma-informed care in job descriptions. Considering how to integrate a trauma-informed approach into supervision. Looking to have supervision mirror the trauma-informed principles, so trauma-informed supervision practices. Establishing formal processes for regularly addressing the impact of secondary traumatic stress and vicarious trauma on staff, and incorporating the commitment to trauma-informed care into the hiring process. So you'll notice in a lot of these strategies that I'm just reviewing with you briefly now, it's about, at the work group level, developing formal strategies or mechanisms to make sure these become embedded into how your organization functions, right? So developing a formal mechanism for involving, so in the establishing trusting relationships domain, this is really about how you're giving service users a voice. What are your formal mechanisms for involving service users in decision making? What are the challenges to involving service users that could lead to resistance among staff? Really identifying those and developing strategies to address them. Ensuring there are ongoing feedback loops in place from service users about their experiences of the agency. Really asking some questions about establishing trusting relationships, like what kind of practices do we need to put in place to be more open and transparent? How can we convey more respect in our language and actions, and translating that into goals? Having a formal process for identifying potentially re-traumatizing practices and figuring out how to minimize those in your system. And considering what are the formal strategies to take for how to support culturally responsive environments. From a respecting service user perspective, we're really looking at the environment, both how to maintain a safe and welcoming space, how to make sure that people are respected, right? What are your wait times? What's the level of privacy? How are people greeted? What do the physical spaces look like? What do they say about those? Do they reflect the core values of a trauma-informed approach? What's your process? Developing a formal process for identifying and minimizing potential triggers or trauma reminders for folks that stem from agency environment or practices. What are additional steps you might need to ensure privacy and confidentiality? How do you involve folks that have had similar lived experiences to those being served in a more formal and informal ways? How do you offer peer-led programming and ensure that this perspective informs the service design? Those are some examples under Domain 3. For the fostering trauma-informed service delivery domain, it's really thinking about how trauma is addressed in program-level assessments, right? How's it being asked about? How's it being considered? How are assessments conducted, right? Whether these are intake assessments or more long-term assessments, are they conducted in a way that upholds the principles of trauma-informed care? Are there formal changes needed, right, to assessment processes across the agency? How do you ensure that goal setting with service users is collaborative, right? So not just one person does that really well, but how do you ensure as a program that you operate in that way? So what are processes that you might need to put in place or checks and balances? How do you adopt consistent strategies for educating service users about trauma? Maybe there's a formal program or maybe there's formal training that you want to develop. How can you be more consistent and predictable in your service delivery across divisions, programs, and individual staff? From a policies and procedures perspective, we're really looking at how do you develop formal policies that reflect a commitment to trauma-informed care. How do you develop formal policies that include a commitment to cultural awareness and culturally specific practices that are so connected? What kind of formal review process do you have, and how does that include staff and participants when you're looking at your policies and procedures? And really making sure that the policies and procedures that you do have align with the core principles of a trauma-informed approach. So that's just a flavor of the types of things that you might start to think about and look at if you're really looking at this from an organizational lens. And then for folks that maybe are further along, even on this call today, how do you sustain it? It's things like making sure you maintain regular meetings of the working group, that maybe you reassess your progress yearly to see how your kind of scores or results on assessments change. Making sure you are evaluating the impact. If you're taking the time to make this kind of organizational effort, really collect data, both quantitative and qualitative, on whether things change over time as a function of adopting this kind of approach. I would say that it's always much more difficult to go this alone, even within an organization that's got a lot of champions. So really encouraging folks to network with other agencies that are also committed to this. So really building kind of cross-agency communities of practice so that you can share ideas, you can share challenges when you get stuck, you can share lessons learned. And another way to sustain this is to learn it and educate others so that you become the community educator about trauma and trauma-informed approaches. So I want to stop in just a couple minutes here so that we make sure we've got time for question and answer, but I just want to read a couple of quotes from a few organizations that we did a 2-year kind of pilot of a trauma-informed approach with, and some of their comments about kind of what this change started to look like. So certainly folks noticed changes in staff understanding and response, and maybe this rings true to some of you on the call today who have done this work. So for example, a case manager said, it's given me the tools to really start to work on a different level with the women and for the women. In this case, she was referring to a women veterans program. Now I know where they're coming from. It's not just mental health, personality, or non-compliant. There are really reasons why they're doing what they're doing. Or a program director who said, definitely I see a change, especially in the way our resident advisors treat the clients. People tolerate more, they show more empathy, and they try to understand why a client is acting that way is because of this instead of seeing them in a more negative way. Or I thought this was a really great example from a clinical manager. I'm listening to my staff, the way they're beginning to talk a little bit differently. So in the past, we used the term verbal assault if a veteran got upset and started screaming at staff, and we wouldn't put up with that. A new way to talk about it, it wasn't verbal assault. This guy was really upset that someone stole something of his. It was a verbal outburst. Just changing the words rang a bell. We don't have to kick him out. Let's work with him. And then we really saw changes to staff communication and cohesion, particularly with the institution of working groups. So one administrator said we tend to be very siloed. So a working group together thinking of ideas that we can do together and the interactions together has been a big step. A case manager in one of the working groups said it helps us to understand one another, to be able to work with each other, and to understand that we all have trauma. And a clinical director said sometimes it can be a little challenging. Security might do things in one way. Clinicians might handle the same situation differently. Trauma-informed care encourages conversation and a mutual understanding of what's going on and why, which doesn't mean you always find the ultimate, happy solution every time for everybody, but it's helpful to kind of really be thinking that through. And then shifts in awareness of staff needs. So this quote was really referring to the fact that there was more of an awareness that, for example, we had a client that almost died on one of our programs for an overdose, and I probably have a dozen staff that came to me as the clinical manager, and they were very concerned with what we were doing to support the staff member who came across the client. And just reflecting that there's a heightened awareness of the impact of this type of work on staff, and that was really particularly true in the organization where this quote was coming from. So things that we've really learned, our trauma-informed systems change requires investment of time and resources. organizations really do need to be ready to adopt. Leadership presence is needed at all stages of the process, but we also see a lot of ways that adopting trauma-informed care can have a positive impact on everyone in the service environment. So I just want to close with one final kind of poll, just to gauge where you think your organization is. And I know that was a fast overview, but where you think your organization is in this process of adopting. Are you just learning about it? Are you beginning to adopt? So not just your awareness of it, but this actual adoption. So it looks like for some of you, a smaller group of you, it really is part of your formal and mission and practice already, which is terrific. And it sounds like, I would say about almost 40% of you are saying you're beginning to adopt, but, you're just early in that process. And then it looks like about a little over 40% of you are saying you're just learning about this, but haven't taken formal steps to adopt it. So great. Sounds like a lot of you are on your way. So I want to stop now just to give folks an opportunity for Q&A. Sorry, I went over just a little bit, but we still have a little bit of time as well.
Thank you, Kathleen. We do have quite a few questions that I can throw to you really quickly.
Great.
The first is, can you provide a good working definition of trauma?
Sure, so that's a good point, and I didn't on these slides. So when I'm talking about trauma, we're really talking about an experience that overwhelms, at the basic level, is an experience that overwhelms the body's ability to cope. But I think it can be useful to use, SAMHSA has kind of the 3 E's of trauma. So it talks about trauma as an event or set of circumstances, that's the first E, that's experienced by someone, right, as physically or emotionally harmful or life-threatening, and is overwhelming to our physiological system, and has either short or long-term adverse effects. So that's the third E. For some people, they will experience an overwhelming event but be able to move on from it relatively quickly, while for others it will be more difficult.
Thank you. Another one for you. Is this approach geared towards emergency only or overall for how to approach patients that are being seen?
It's really ideally for overall, and I would say that if you're talking about an emergency kind of department, right, or program, I think different programs or different types of departments may integrate this in different ways to some extent, right, depending on kind of the pace and context with which you're providing services. But yeah, this is really ideally something that is an approach that could be done in both overall and within the context of a particular program or department.
Thank you. How do you provide a trauma-informed approach to workforce development, such as accountability, reliability, time management, things of that nature?
Yeah, that's a great question. So we've been talking a little bit more about this here and with some others, and I think there's sort of a twofold, I don't know, in my mind I think about, well, certainly if you're providing workforce development services, you could be providing them in a trauma-informed way, right? So that includes all, your organization being trauma-informed, which includes all the things that we just talked about. But I think in particular, in the context of supporting people and being kind of prepared for the workforce, it can be really useful to help people understand how trauma may potentially affect that, right? How their response, what might trigger them in a job, what might be difficult, what might an automatic response be that might get in the way of success in the workforce. So I think there's a lot of potential education that could be done as part of that awareness of trauma and its impact in the context of workforce development. But I also know, and this is particularly true with folks working with youth in that context, that there can be real value to working with employers around understanding this context, right? Or folks who are providing employment services being trauma-informed, and maybe they aren't going to do that in exactly the same way the social service setting would, but so I think there are kind of many sides to that workforce issue. There's both kind of the way you work with people, providing any service, then there's specifically how you might educate folks around trauma as it relates to work issues. And then there might be the working with folks who are helping to employ people on how they understand trauma and its impact and what a trauma-informed approach would look like for them.
Great. And then one more. Do you have ideas on how to actually measure the value that's added from trauma-informed care work?
Yeah, so can you say that one more time?
Sure. So the requester is looking for ideas on how to actually measure the value added from trauma-informed, I guess, policies, programs, and the trauma-informed approach.
Yeah. So I think step one is to be able to measure your trauma-informed approach. And that's what I think the instrument's really helpful for. And I just want to note that somebody was referring in the chat box to another psychometrically validated instrument called the Arctic. And I want to point that out because I think that's a great tool as well that measures staff attitudes. And I think it actually could be really complementary to our capacity scale, which is more about measuring broader organizational practice. So I just want to make note of that and acknowledge that. Thanks, Pat. So I think number one, it's measuring your current degree of it, right, and how the degree of trauma-informed care changes over time, and then how that potentially corresponds to other changes over time. So, you know, I think in all cases, it's sometimes difficult to connect what causes, right, or precipitates one or the other. But I think the first step is to be able to say, okay, how trauma-informed are we using these tools, right? And then what is our current data on things like, you know, whatever it is that you're looking to kind of measure, whatever your measures of success for outcomes for your organization are. Where are you at with those currently? And then over the course of time, say you develop a plan and over the course of a year you're instituting or implementing these other trauma-informed practices, it's then actually measuring again trauma-informedness, right? So how are we? Has that changed? Has that gone up, ideally? And how have those other quantitative measures, kind of those things that we use to measure outcomes, how have those shifted over time? And obviously, you're looking at correlations, but I think that's why having a concrete evaluation plan that both evaluates the quality of your services and then how that might relate to outcomes is useful. So hopefully that's the beginning of thinking about an answer to that question.
Wonderful. We have time for one more. Do you have a suggestion on how to begin a trauma-informed organizational process in a very large organization?
Yeah, that's a good question. So I guess one of the first things that I would say is that it might be useful from the very top of the organization to see what degree of interest and investment there is in supporting this. And if it varies by programs, right, you certainly could start by piloting this approach in one part of the very large organization. I will be honest that I think success in that could be hampered if the larger leadership isn't supportive of it. But if you've got folks that are saying, this is good, we're really interested in implementing it, but implementing it organization-wide could be really overwhelming, then you certainly could start with a couple of quote-unquote like pilot programs. The other thing I would say is we work with a multi-service organization that's very large and actually has like 70 different types of programs or maybe more than that. And they used the scale and we generated program level reports for all, I think it was 50-something programs that were involved. So they really did want to take an organization-wide approach to it, but depending on the results, different programs may choose to focus on different areas. So I think there are kind of a number of different ways that you might be able to break that down if overall is a little bit much.
Thank you. And thank you, everybody, for joining the webinar today. A link to the archived webinar and slides will be available on our website, www.nhchc.org, at the conclusion of our spring virtual training. We anticipate those going live about the first week of April. Questions that the presenter was unable to respond to will be addressed via email if possible. As a reminder, in order to claim CME credit, you must text the code provided within 24 hours of the session ending. At the close of this webinar, an online survey to evaluate this webinar will automatically open in your web browser. Please complete it and help us improve your webinar experience. The meeting will now be closed.